बात करने के लिए फर्टिलिटी होती क्या चीज़ है और क्या कॉजेज़ हैं, क्या कारण हैं इनफर्टिलिटी के, फीमेल में, मेल में या और क्या तरीके हैं। एक बात आपको बता दूं कि आजकल इनफर्टिलिटी इज रियली ऑन द राइज. I now see girls as young as 29, 30 years coming up with egg count so low, and I'm always wondering what has changed that is causing infertility. Let me just start in a very, very broad manner. To make a baby, we know we require an egg from a woman, a sperm from a man, and a healthy uterus to harbor a pregnancy. कैसे शुरू होता है? एक ओवरी से एग निकलता है. एक हमारे जो फिलोपियन ट्यूब्स हैं, दे शुड बी ओपन टू कैच होल्ड ऑफ द एग, एंड देन द एग आराम से फर्टिलाइज होता है फिलोपियन ट्यूब में, एंड देन स्लोली इट वॉक्स अराउंड एंड टेक्स अराउंड 4-5 days to reach in the uterus, which has to accept it with open arms. It should be thick, the lining should be thick, it should be vascular and receptive, as we see. So there are a lot of patients who will not have a receptive endometrium. Pata chala, egg and sperm have met. There's a good embryo, but the endometrium is not receptive. So let us talk of what is fertility, and when you say infertile, when is the time to go to a doctor? If you have been together, the husband and wife, or the partners for 1 year, and they have unprotected coitus, if they are less than 35. If they are more than 35, then less than 6 months. 6 months is also more than enough of trying. And if you've not conceived, then you should consult a doctor. Now, reasons, as I said, can be in the woman. So first and foremost, and most important, is their age. If you got married at 34, then please don't wait even 1 month. Go ahead, try a pregnancy, because 35 and your egg content and the quality and the quantity both start coming down. So age is nothing I can emphasize in this talk more than age. Best eggs are between 21 to 24, and no, most girls don't get married at that age. So once you have crossed that age is one barrier. Then coming to the ovary. Now, ovary is another cause. You can have a polycystic ovary. It's very, very common. You have a lot of eggs coming up, but not one good single egg. So it's a hormonal imbalance. So, your hypothalamo-pituitary ovarian axis, the hormones which come in, have to be in place. Your thyroid should be under control. Your diabetes, your sugar should be under control. Your, the prolactin levels should be less than 25. So all the hormones, they have to be under control if we have to have a good egg. Now, the egg is there, whether you are ovulating or not ovulating. So, that in polycystic ovary, you don't ovulate, you sometimes require help. Now, if you're ovulating, please check out whether your tubes are open or not. If your tubes are blocked, there is no place where the egg can come and get fertilized. Now it has got fertilized and the tubes are open. Now it is coming into the uterus. Is the uterus there? Well, there are some girls who don't even have a uterus. So make sure the uterus is there. Is it a uniconvate or a biconvate uterus? Is it a septate uterus? कोई anatomical defects हैं क्या उसके अंदर? तो यूट्रस की जो शेप है, साइज है, जो उसके अंदर एडेशंस हैं, पॉलिप है, फाइब्रॉइड है, यानी कि पहले ही कुछ बैठा हुआ है, तो where the baby will not come and stay. Okay. Now, why do your tubes get blocked? We talked of blocked tubes. Why do they get blocked? Because of sexually transmitted infections. Always teach your young girls to use a condom, to be away from sexually transmitted infections, because chlamydia, gonorrhea, tuberculosis, all of them can cause a tubal blockage. Very, very common in India. So it is something that I would like, to please understand. Now, हमने बात करी एग नंबर्स की. वी आर ऑल born with a finite number. देखिए, unlike males, we don't have so many eggs. We have a finite number of eggs which we are losing every month. So in the end, हमारे पास eggs कम होते चले जाएंगे. You can, see yourself by getting one test that's called the serum AMH. You can get that test done and know where you stand. अब ये eggs, हमारी जो genetics है, ये इतनी important है. All of us may be carriers of one or the other genes, and in which some of them you may have a premature ovarian failure or premature ovarian insufficiency. तो ये genetically अपने को check करना कि we are is our karyotype, our whole exome screening when done is all under place. There is nothing else. अब कई बार लोग कहते हैं हमारा बच्चा mean we get pregnant but we lose the pregnancy or we have recurrent pregnancy losses. What can be the causes besides genetic? That is one thing you have to be sure. Second are immunological causes. आप लोगों में से कितने लोगों को थायराइड है? It can be an autoimmune cause. There are so many other diseases which are there. If you have an immune cause, then again the pregnancy is not going to get accepted. And third cause is thrombophilia, or disorder in which there's clotting and there's not enough blood flow both to the egg and the embryo, and there is the growth of the embryo doesn't take place. So all these are required to be sure. As I said, your tubes, your ovary and your uterus should all be in sync when we are looking at what are the tests you can do. Of course, a ultrasound, a pelvic ultrasound, a transvaginal scan to make sure that the shape of the uterus, the shape of your ovaries, everything is in place. If you see an ovary which is stuck behind the uterus, there may be endometriosis. So polycystic ovary, endometriosis, fibroids, all have to be ruled out by doing a pelvic ultrasound. Of course, to make out that your tubes are open, you have to have a hysterosalpingogram. And if your hysterosalpingogram or shows a block, then you can undergo a laparoscopy to make sure that it is not spasm but block, which we are dealing with. So, serum AMH is your egg reserve. So, you've looked at the ovary, you got an ultrasound done, looked at you've got an HSG, you've seen the tubes, you've seen the uterus, and now when everything is all right, then you can say, okay, the female doesn't have too much of an issue. Now, let us come to the males. What about males? Now, God has been very kind with males. He has given them a factory, that is the testes, where sperms are produced forever and ever. So, if you look at a sperm, always look at them as a couple and just do one sperm count for the male. Look at the number, the motility, and the morphology of sperms. If you have more than 15 million and you have a morphology 4% and above, and a motility of 40% and above, then you can be more or less sure. Especially for your babies, please look at undescended testes. Sometimes they are missed out. Sometimes you have torsion of testes gets removed. The other thing is, the other disorder that a male can have, besides infections, which are very, very common, is unless erection and ejaculation disorder, which can be there in the male. That means if you have a spinal injury and the nervous supply to the organ is disturbed, then erection and ejaculation can become a problem. Some of them may have had a vasectomy. So your factories are the testes, which are producing sperms. Now this gets collected through a tract, which are the vas deferens, which go through the bladder, and then through the penile canal, and there can always be blockages, which could be because of sexually transmitted infections, or otherwise, some of them get a vasectomy done for whatever reason. Then it is not easy to reverse that. But if there is a blockage, you can always first go for a microscopic reversal of the blockage, and then, let me just make one thing very clear. Even for men who have no sperm at all, we can have a genetic baby by just putting in a needle in the uterus or in the epididymis, taking out and aspirating the sperm. What do we call it? TESA or PESA, in which we just aspirate the sperm and then undertake an IVF ICSI procedure, and you can have your genetically your own baby. Remember, in males, lifestyle makes a big difference. Why testes are hanging outside in a male is because they require a cooler temperature. So, if you are working in smelting and furnaces and keeping a laptop always on so whenever you're giving heat to the testes, the chances of sperm getting damaged is higher. So, tobacco, alcohol, smoking, drugs, stress, all of these have a damaging effect on the sperm. So, if you are trying for a pregnancy, please try to be away from all this. And what you really require is a sperm, as I said, just a sperm count, a genetic test on the male, because there are a lot of Klinefelter syndrome and microdeletions and so many other syndromes which are there, which will only get detected when you do a genetic testing on the male, a scrotal or a transrectal ultrasound wherever it is required. So these are female and male causes, and of course, 30% are unexplained. That means when you do broadly the test, that means ovulation, the tubal testing, and the uterine, and you cannot really see something, you call it unexplained. And 30% or one third of the cases come in. So please don't get perplexed if you don't get pregnant. एटलीस्ट वन थर्ड लोग ऐसे हैं जिनके अंदर कुछ भी खराबी नहीं है, यानी कि मेल भी ठीक है, फीमेल भी ठीक है, और फिर वो पूछते हैं कि हमारे को बच्चा क्यों नहीं हो रहा, क्योंकि वी हैव टू गो इनटू मोर एडवांस टेस्टिंग. यू कैनॉट जस्ट एक ब्रॉड सा देखने में लगता है सब ठीक है, बट अगर हम उसके बारीकी में जाएंगे तो हम देखेंगे कि उसमें भी कहीं ना कहीं कोई प्रॉब्लम है. सो अनएक्सप्लेन्ड इनफर्टिलिटी इज अनदर मेल कॉज. सो आई थिंक विद दिस आई कैन जस्ट से कि आज पॉसिबल सबको बच्चा करने का तरीका है. अगर आपके पास एग्स नहीं है तो एग डोनर ले सकते हैं, स्पर्म नहीं है तो स्पर्म डोनर ले सकते हैं, टेस्टिकुलर एस्पिरेशन, पैसा वैसा ये सब टेस्ट कर सकते हैं. आईवीएफ एक ऐसी तकनीक है, एक ऐसी डेवलपमेंट हुई है जिसमें बच्चा हम बाहर बना सकते हैं, यानी कि एग बाहर निकाला, स्पर्म बाहर निकाला, दोनों को मिलाया, एम्ब्रियो बनाया, एंड देन वी कैन put the embryo back into the woman's body. And of course, till now, there is surrogacy is there, for people who have a damaged uterus can undertake surrogacy. Of course, now we have the law coming in, which is prohibiting, but otherwise, this is also another way to get pregnant. IUI is a simpler method in which we are just washing the sperm and pushing inside the woman on the right day, just close to the egg, which is the other way to get pregnant. So, with that, I will put an end to what is fertility and what are the causes which normally broadly make a person fertile or infertile. And I'll be very, very happy if there are any questions that you would like to ask on this topic. Okay, so the first question is, does age impact a woman's or a man's fertility? Yes. Age is the most important thing that affects fertility. And I will ask every single girl, to be very, very conscious, because your fertility clock is not going to wait. So, whatever your circumstances is, try getting pregnant in the right time. That means before you are touch 35 should be your target. As far as a man is concerned, yes, it does. There is something called an andropause also, but I wouldn't say that it gets affected to that much. So he can still be 50, 55, 60, still have sperms, unlike a woman who will not have any eggs. So yes, age does impact. So, who should see first? Should it be an obs-gynae or a fertility specialist? Well, now with fertility specialist coming in, I would say please see a fertility specialist, because in broad, I'm sure, when you start, when you just been married, you can always go to an obs-gynae, but sometimes obs-gynecologists also keep the patients too long with themselves. And then suddenly, they said, oh, हम तो 10 साल से एक डॉक्टर को दिखा रहे थे, उसने हमें क्यों नहीं बताया कि एग्स इम्पोर्टेंट हैं, तो या स्पर्म्स में हमारी ये प्रॉब्लम थी, या इसका कुछ हो सकता था, हमारे तो कोई स्पर्म्स इजैकुलेट में थे नहीं. So I think with a lot of fertility clinics being there, it is the right time to visit a fertility specialist rather than an obs-gynae. What impact does infertility have on psychological well-being? Well, this is something which I am most empathetic about, because I know बोलना आसान है, पर हर महीने I've seen my patients cry every single month when they start menstruating, and it takes them a long time before they can pull themselves up and come back to the doctor, because this is not easy. to sit on that chair and undergo cycle after cycle, not see success day one. Remember, IVF has 50 to 60% chance of success, so not 100%. So there is nothing that we can do to give 100% and assure you that no, you will always get a baby in the first go. So I always believe that patience, perseverance, and some amount of finance is required when you are undergoing cycles. And it is okay, you will be making money later on. You can actually invest into this. Later on you can think what to do with money. At the moment, I think one should always be devoting time and energy both, and to this process of fertility. So everybody, just don't give up. That's the idea. How is infertility treated? Well, infertility, after we have made out the cause, suppose your tubes are blocked, you can have a microsurgical reconstruction of the tubes. You can, if there is something which requires, if there's a endometriosis, it requires some kind of fulguration of laparoscopic procedure, you can do that. If there is an anatomical defect in the uterus, you can always correct that. So hysteroscopy, laparoscopy, and wherever myomectomy is required. So जो भी प्रॉब्लम निकल कर आई है, चाहे फाइब्रॉइड्स है या एंडोमेट्रोसिस है, उसका करेक्शन करना। और उसके साथ साथ हम लोग, क्योंकि ओव्यूलेशन इंडक्शन ड्रग्स हैं, हमको भी मालूम है कि आप फाइनली द आइडिया इज टू गेट प्रेग्नेंट। तो इसके साथ साथ हम लोग आपको ओव्यूलेशन इंडक्शन ड्रग्स देंगे या स्टिमुलेशन देंगे, ताकि कुछ अच्छे एग्स बने एंड वी गेट यू प्रेग्नेंट फास्ट. सो IUI इज वन वे एंड IVF इज द अदर वे. एंड IVF के साथ साथ एग डोनर, जैसे हमने बात करा, स्पर्म डोनर, सरोगेसी, ये सारी चीज़ें आपके आर्मामेंटेरियम में बहुत कुछ है. सो प्लीज़ डोंट गिव अप. दैट आई थिंक इज़ द मोस्ट इम्पॉर्टेंट की मैसेज दैट आई वुड वांट, कि आप माना है कि कभी कभी सक्सेस नहीं मिलेगी, बट गेट अप एंड गेट गोइंग अगेन. सो सक्सेस उन्हीं को मिलेगी जो लगे रहेंगे इसमें. What fertility testing should our fertility doctor perform? So, I think if you ask me, basically, a serum AMH on a woman to say what her reserve is. Suppose एक लड़की मेरे पास आई है and she's 31, she's just got married and her AMH turns out to be 0.6. अगर 0.6 उसका AMH है, तो I will not give her the time कि आप कोई बात नहीं बेटा, साल 2 साल बाद नहीं. She doesn't have the time. She'll have to start now. But if her AMH is say 4.5, then it's okay. Let her take her time. वो एक आध साल भी ले लेगी तो कोई problem नहीं है. So serum AMH is the first test. Secondly, a good TVS ultrasound or a 3D scan to make sure कि uterus की anatomy and everything is in place. Lining सब ठीक है, ovaries की जगह पे है. And third is a hysterosalpingogram of the tube. HSG, ताकि ट्यूब्स खुले हुए हैं. तो अब आपको मालूम है कि स्पर्म आपने अलग से देख लिया, स्पर्म काउंट का मोटिलिटी मोर्फोलॉजी देख ली, स्पर्म ठीक है, ओवरीज ठीक है, ट्यूब्स ओपन है एंड यूट्रस ठीक है. तो मोटा माटी आपने इंश्योर कर लिया कि दीज आर ऑल इन प्लेस. ऑफ कोर्स योर थायराइड, योर डायबिटीज एंड योर अदर टेस्ट आर side by side also equally important. So, what increases a man's risk of infertility? Now, a man, as I said, has to be very conscious of a temperature. And we just talked on laptop and furnaces and tight boxer shorts, cycling. All these cause increase heat to the testicles. A lot of sauna, steam baths. All these will increase the temperature, and this is one thing. Others are drugs, alcohol, smoking. These are something that you really will have to give up for some time, at least for some time, if not forever. Till you are trying to conceive, because that all has a very very big impact on a man's sperm count. So also, if somebody has undescended testes, it's also important because they can become cancerous if they are in the abdomen and have not been removed. So a man's risk is much lesser, and I think he just requires to do a little bit change, tweak his lifestyle, and that is enough to rule out any infection. Some of them get recurrent infections, urethritis, prostatitis. So keep looking at those infections again and again, because they can all cause blockage and trouble in his fertility. So, my takeaway message to all of you will be that please be conscious. I have even celebrities and actors coming in, and they all said to me the same thing. I wish we knew. I wish we knew. Otherwise, if I thought I'm menstruating every month, I'm leading a very healthy lifestyle. I eat healthy, I exercise. There is nothing. And we never imagine that at 39 or 38, I will not be able to conceive. So, the awareness that your clock is ticking away, it is very important that before 35, you try to conceive, or everything else can. Otherwise, please go and preserve your eggs. Now you have cryopreservation of eggs. You can always preserve your fertility in time. Dinah Hayden preserved her eggs at 30, and she thawed her eggs at 40 when she got married and she had a baby. So she was well aware. Many stars, or even people in status positions, do not understand that, and they think leading a healthy lifestyle is all that is required. So please remember that this is a very natural decline, and you cannot control this, like something like aging, which you just cannot control. You can do many things to arrest it, but you cannot control it. So similarly, I would just say that please be very conscious of your age. If you think you are a model, or you are in a profession, or you're really taking off and you will not be able to give time to a pregnancy right now, it's all right. Then please preserve your eggs, preserve your sperms, wherever. So cryopreservation is a very, very important fact, and many girls are now coming in, if they are really into high flying careers, which take them away. Google and Apple and all the Microsoft told their employees to that they would be paying if they, if you, because they know they are all hardworking people who may not have time to have a pregnancy. So they told them all to go and preserve their eggs. So, and the company was paying them. At that time, there was a lot of halabaloo about it. How can ऐसा कैसे कोई कह सकता है? बट ये सच्चाई है जो हम सबको फेस करनी पड़ेगी, कि वक्त होते हुए आप अपना फर्टिलिटी को प्रिजर्व कर लीजिए. अदरवाइज you will lose the, you'll miss the train. So I will only ask all of you to. I am Dr. Rita Bakshi, again, Chairperson Riza IVF International Fertility Center, situated in Green Park, Delhi. If you have you can note down my number is 98101 43703. I repeat, 98101 43703. In case you have any queries or any questions, and I'm always getting them, very happy. After I finish my talk, I get a lot of queries on my WhatsApp, people asking me personal, which they are not able to ask me here. I'll be extremely happy to help you all out on your journey to fertility and having a baby in your arms. Thank you so much.